Doctor, would you come up, please?
Am I supposed to hear?
Yeah.
I'd like to ask a question. Now, like, we had a laceration there. Tell him that's not going to hurt. How long would that be effective?
Well, that might be effective as long as you want it to be effective. How long do you...
Night or something?
Yeah, well, I wouldn't put a limit on it. Now that won't bother you anymore. You just won't feel it from this point on. You'll get well, and you'll have no pain at all there. No discomfort at all. I wouldn't use the word pain, but that would be the idea. You'll have no discomfort at all while that recovers now. And you'd be surprised how much post-operative discomfort you can eliminate by this procedure. You can eliminate practically all of it. Doctor, suppose you come on up. Yeah. Mm-hmm.
You want me to go ahead and...
Oh, yes.
What we did a minute ago?
Yes, yes, and not only that, but I would go through the semantics so that I hear the semantics you use in getting a bronchoscope examination. We'll just start from the beginning. He's just come in, you got some work to do. And
to look down in your throat, if you're relaxed, we can see everything we should see. And the more we see, the better it'll be for you. If you'll relax, we can look straight down in your lungs without hurting you.
Don't use that word hurt.
That's right.
Without you feeling any
Without you feeling any
change and the changed movement when you said hurt.
Yeah.
There's a direct passage from your mouth right straight down if your muscles are relaxed, and I can lean your head back. But to get you relaxed, first uncross your legs and get in a comfortable position. And to relax your whole body.
Take a good long deep...
Take a good long deep breath now. And watch my hand as it moves
closer
down.
to his eyes. Closer.
As it moves down. And as it moves down, your eyes will relax so much, they'll be so heavy, that you can't open them.
No, that they just won't work.
They just won't work at all.
And
now your eyes are so heavy, they won't work at all. If you want, you can test them and see what I mean. They won't work at all. And now let that relaxed feeling go all the way down to your feet. Relax all over. Every breath now, let your throat muscles relax. So we can tilt your head back and look straight down your lungs. Notice how it relaxes every time you breathe. And now we can open the mouth, put our tongue out just a little, and see all the way down to the bottom.
Very nice, Doctor. The semantics were good. Notice how the compounding has compounded the relaxation that he's got. See what a beautiful relaxation he's got? See? Now, that's probably more depth than you've ever seen, I'll bet, in your work, isn't it? You see some pretty good depth in your...
Yeah, but not like this.
Not depth like this. You get such a beautiful depth. Look at what beautiful relaxation he's got. He's probably feeling better than he's felt for ages. And that's so. You do feel good, don't you? Isn't that
Yes, sir.
Now, you're all through working with him, and now tell him his throat is going to feel wonderful, and he's going to feel grand when he opens his eyes, and that's all.
Now, this relaxed feeling will pass away from you.
No. When I have you open your eyes, you're just going to feel wonderful. You want to hold on to the relaxation. Let him hold on. Relaxation is good for a person. We have too many natural tensions, not natural tensions, but civilization gives us so many tensions we shouldn't have. So just say that you can hold on to this relaxation. When you open your eyes,
when you open your eyes, you can hold on to this relaxation.
And notice how good you feel.
And notice how good you feel, better than you felt for a long time. So open your eyes.
Had a pleasant feeling that, huh? It was a nice... He went plenty deep. Now, you know when he probably went to... You know how close he was to He was probably somnambulistic, and he may have been even deeper. I don't know. I would have had to make some tests at that point to find out, but I can tell you, you had depth.
Yeah.
You had depth.
We could have gone.
Oh, you could have gone plenty ahead at that time. Very nicely done, Doctor. Thank you. Doctor, suppose you come on up and practice.
How you do?
How do you do?
You've been complaining of those sinuses, haven't you?
They've been bothering me quite a bit lately.
Would you like to get rid of that, wouldn't you? If you can relax, you will relax. It'll help you. Now, that's the first thing let's do. Let's uncross the legs. Sit back in your chair. You have your hand there now.
Don't forget that long, deep breath, Doctor.
Take a deep, long, deep breath. And there you go. Now watch my hand. Let your hand, eyes, carry with my hand as it comes down.
There's depth. There's depth already. You see what I mean? A beautiful relaxation.
Now as this relaxation comes down over your body, over your torso, over your hips, down to your feet, your hands will drop heavy as I let them drop. Now, I'm going to do a little work on this sinus. And you're not going to feel a thing. You'll know that I'm touching, but you're not going to feel a thing. And when I get through, your nasal capacity will be completely open. You'll have more fresh air than you've had in weeks. Now, you never felt a thing. As you take a deep breath, breathing will be easier. It will smell more sweet. Fresher. When you open your eyes, you will feel better than you have felt all day. All right, you may open your eyes now. Will you feel better?
Very good.
What did that do to you, son? What did that do to you?
Felt a little pressure up here.
You were practically in the supraorbital notches, weren't you?
What?
Yeah. Do you know that he was in the supraorbital notches? And
Put about 50 pounds, about 25 pounds.
Didn't feel like that,
Felt
but
very little. Actually, I just was aware that he was doing something there.
I saw.
Do you feel like you're breathing?
No, I feel very well.
Breathing is good.
All right.
Sure. That was a nice work, Doctor. Very nice work. You've used hypnosis before, I see.
After you last the other day, I tried it.
Oh, find out it works. Find out it works. Okay, very nice, Doctor. Mr. Maddox was very good. Don't go away. I want you to work on the next one. Would you come up, Doctor? Incidentally, if anybody's in any special branch of medicine, what branch are you in?
I'm in dentistry.
In dentistry, and you're in...
Physicians, doctor.
Okay. All right, Doctor.
Doctor, it would be wonderful if we could make you relax. Our visit would be much more pleasant today, and there is a way that we can do that. It's called medical relaxation. One thing with the world today is one of the worst things is that we haven't learned to relax, so we're going to try something that I believe will help you. I want you to take a very long, deep breath, please. Take a long, deep breath and exhale. I want you to try to relax now. Take a long, deep breath. I'm going to put my hand above your eyes.
Oh, take the hand, Doctor. That's important.
I'm going to take your hand. I'm going to put my hand above your eyes, and as I bring it down, just slowly close your eyes.
Watch the hand, you know, that's the idea.
Watch the hand, slowly close the eyes. When your eyes are closed, test the muscles and make sure they're closed. Make sure that they will not open. Just relax now.
Now let the feeling go down to your toes.
Let the feeling go all the way down to your toes. Just relax. It's a wonderful feeling, isn't it? In just a moment, I'm going to lift your arm and see that you're cooperating with us.
No, I would say that he's relaxed.
See if you're relaxed.
That's
Just
right.
a moment. I'm going to lift your arm and see if you're relaxed.
Now don't help. In other words, tell him not to help you. I wasn't satisfied with that because it looked to me like he was right next to it, but that he was helping you.
Okay, let's try that again. Let's try that again. As I bring my hand down over your eyes, let the eyelids follow the hand and close. That's fine.
Relax to the point where they won't work.
Relax to the point where they will not work. Test them and make sure they will not work.
That's it.
Test them and make sure they will not work.
Now stop testing them and let that feeling go right down to your toes. You know, that would be your technique with a man like this. Do you see what I mean?
Let that feeling go all the way down to your toes now. Let that feeling go all the way down to your toes. In a moment, I'm going to lift your arm and we will see how relaxed you are.
I want to be completely relaxed.
I want you to be completely relaxed.
Now you're getting much more, you see. That's it.
Just
you see, from here I could see how much more you had. So, now, is there any doubt that there's a threshold change at this point? But you see, he must have that relaxation to get the threshold change. Now you would add your selective thinking doctrine.
In a moment, we're going to have you open your mouth, and you will feel nothing that we do. We're going to put your teeth to sleep. No?
No, that's wrong. Semantic doctrine. No. At this point, you just won't feel anything. That's all you'd have to say. You don't have to do that. Other stuff puts doubt in their minds.
You will feel nothing at all that we will do.
Okay. You know we're working there.
You will know that we're working there, but you will feel nothing at all.
That's right. Now, doctor, in order to prove that to you, and prove it to the doctor there, who is doubtless one of our men who is skeptical, let me show him how little he will feel. Would you go in there and using that, let him see where his threshold has disappeared to?
Open your mouth, please. Want to press in on your gum tissue.
That was nice. She didn't feel anything.
Felt very low.
Yeah. And you see how this old-fashioned idea of now your jaw is going to sleep and all that sort of stuff, a lot of rot. The way to give a suggestion is now you won't feel anything, and then you don't have to have it go to sleep or anything else, and he's got anesthesia. You know?
In a moment, I'm going to have you open your eyes, and you will feel very well. You'll feel better than you felt all day long. Take a deep breath.
Well, you can tell him not to open his eyes.
Open your eyes now, please.
How do you feel?
How do you feel?
How much did you feel of what he did?
How much did you feel here?
Practically no pain. I felt some pressure.
You felt some pressure. You went clear down to the periostea.
I mean, that'll give you an idea, Doctor. The most skeptical has to be convinced when a thing like that happens to himself. Isn't that right? Now, you're from this end, isn't that right? Yes. You were from this side. Let's get somebody. Is there anybody over there that didn't practice yet? Come on up, Doctor, will you please?
Doctor, today you're the patient, and we're going to try few diagnostic tests to get a little more information about your case. It'll be much more comfortably done. We'll get much more information that will be of value to both of us if you're able to relax. I want to try to get you to relax so we can get complete cooperation on the whole procedure. Now, take a deep breath and relax all you can. Now, follow my finger. Now, make your eyes closed. And let them relax completely until they just won't work. When you're sure they won't work, I want you to test them. Now test them. All right, that's fine. Now I want that same feeling of relaxation go from the top of your head to the tips of your toes. You'll feel much more relaxed in just a moment. When I lift your right hand, you'll be completely relaxed. Now from now on, anything I do will not bother you. Nothing will disturb you. Now I want to make a test on your right shoulder to see how relaxed you are. You will feel nothing.
Close your eyes.
Close your eyes.
That's all right.
Close your eyes and stay completely relaxed.
No, there's fear there, Doctor. There's fear. You see it? It's on his face. Close your eyes, will you please, Doctor? Make a test that he doesn't know anything. That's a test that apparently he knows, see, so he fears it. And there's fear there. If there was no fear, he wouldn't have felt that, because you could see the fear.
I'll make a test.
Now, make a test that he wouldn't know.
And stay completely relaxed. And I'll make a test on this right hand. You won't feel a thing. Nothing will bother you. Nothing will disturb you. All right. Now, that's completed. That's all we need for this time. Now, when I tell you to open your eyes, you'll feel better than you felt all day. Okay, open your eyes.
What'd you feel that time?
I had my finger. You didn't squeeze it very hard, did you?
No, not too hard.
No,
Feeling pain?
yeah. You gave plenty of a test, Doctor. Plenty of a test.
I think it worked the first
I gave him a
time.
real good one here, and I guess it might have been the fact he might have expected.
No, I tell you why you felt it the first time. Being a doctor, he knows that test. That's a common knowledge test, but that's a pretty
We're
sensitive
very close
area.
friends, too.
Yeah,
We haven't
yeah.
ever worked together.
So that the fear would be there, that he would feel it at normal level, because he's had that test done to him at normal level.
I imagine.
See? And so he says, oh boy, now it comes, and see, and the fear is in there, and fear will defeat hypnosis anytime. The reason you've seen such perfect results is the fact that there was no fear present in any of them. But the instant fear came into you, you felt it. See, down here you didn't know what test he was going to make, so he made a very severe test, and you didn't feel it.
That first time I had a feeling my eyes open, I got a flash in my hand. I thought, well, the whole thing's gone now. Maybe that was...
No, that's all right. No, that was very nicely done, Doctor. Nice semantics, too. Incidentally, each man seems to be using better semantics as we go along, perhaps because of the fact that you're catching on quickly, more quickly perhaps than most classes, to what is necessary in hypnosis. Doctor, would you come up, please? Did you practice yet, Doctor? All right.
I can see you're tense and apprehensive about this procedure, but you won't feel any discomfort when you're completely relaxed. I'm going to show you how to attain complete relaxation. So first, I want you to take a real deep breath. Now let it all out. That's fine. Keep your eyes open a minute. Now I want you to look at my hand. As I pass it in front of your face and under your chin, I want you to close your eyes. Now relax your eyelids completely. I want them so completely relaxed that you can't open them. As soon as they're completely relaxed so that you know you can't open them, try to open them. You'll find they're so relaxed you can't open them. Now I'm going to have that relaxation. I want you to let it go right on through your body, clear down to the tips of your toes. Relaxation in your eyelids is going all the way down your body to the tips of your toes, and you're completely relaxed. Now I'm going to lift your arm and show you how relaxed you are. That's perfect. That's complete relaxation. Now we're going to proceed, and you're not going to have any discomfort whatever.
That's perfect. Now, Doctor, at this point, he's got a beautiful state, because I saw that relaxation and it's intense. Is that correct?
Yes.
You could, what branch of nursing are you in?
Obstetrics.
Oh, well. There's delivery now. But you see, what you got to do is just stay. All right, and now you would be able to do an examination. You would be able to do almost anything at this point, and the patient would not. Now you want to bring him out of it. So how would you do?
Now your examination is completed, and when I tell you to open your eyes, you're going to be feeling better than you felt all day. You'll have no discomfort whatever. Now open your eyes.
You got a good state, I'll tell you that. They're very nice semantics too, Doctor. There was nothing the matter with those semantics. Doctor, I think you're the last man to practice. Did you practice? Oh, you didn't? Okay, go on up and...
Yeah. When he was laughing there, is that all right?
Sure. Well, of course. So you don't lose awareness in hypnosis. The fact that a patient laughs when you're working with him, that doesn't mean a thing. Continue to work. Because he's got just as good a sense of humor when his eyes are closed as when his eyes are open, and his awareness is complete. Friends, because of the fact that there are several surgeons here in the room, and several who are working with anesthesia and so on, I would like to show you a typical pre-operative talk, the way we recommend that it be done. You don't know much about this patient, but you want to see her the night before the operation. Maybe you've got to give the anesthesia in the morning. So your method of doing it would be to approach the patient this way. This should be particularly valuable for... there's about 3 or 4 men in surgery here, aren't there? How many men are interested in anesthesia and surgery? You are 1, 2, 3, 4, 5, there's 6, 7. There's about 7. There's quite a number. Here would be your preoperative, that would be 8. Here would be your preoperative talk the way I see it. And I think you'll agree with me that it can be very effective. You know, if you've never met the patient before, I'm Dr. So-and-so, and I will be in charge of the surgery, or I will be in charge of the anesthesia in the morning. And I know that every person facing an operation has a certain amount of apprehension and fear. That's natural to be expected. But we know that you can have a much easier time if we can get you rid of some of those apprehensions. For example, you'd like to get a good night's sleep tonight, wouldn't you, before the operation? So we're going to show you how to relax. And we're going to show you how to relax even when it comes to the operation itself. I think you'd like that, too. And I'll explain some of the things that it will do for you after we show you how to relax. Take a good, long, deep breath. That's right. Now let me have your hand. Now I'm just going to bring my hand down, and you close your eyes. Now relax those eye muscles to the point where they just won't work. Now when you're sure they won't work, let that feeling go right down to your toes. That's right. Now there's so much relaxation that when I lift your hand it will increase, it will double when I lift your hand and drop it. That's right. Now when you're relaxed like this, you can tell how much easier the operation would be for you. Let me tell you some of the advantages of relaxation. For one thing, if you enter the operating room and you're relaxed like this, we can do the operation with much less anesthesia, and yet you will have better anesthesia. Another thing that will happen is that you will have quicker post-operative recovery. You'll get well so much faster. Now, there are certain things we should tell you that should dispel your fears. Surgery isn't what it once was, where they just took you into the operating room and did an operation. Today we have to know that the body can stand the operation. That's the meaning of all the tests that they've been doing to you the past 24 or 48 hours. We know that your body is in condition to stand this operation, and it's going to be much easier on you than you think it will. You're going to find that the post-operative recovery will be remarkable. You won't have any discomfort at all. And you'll feel so good after the operation is over. Now, in the morning, when I see you in the operating room, I'll tell you to close your eyes like this. And when you close them, you'll be just as relaxed as you are now. And the operation will be so easy for you. And when you wake up, you'll be back in your room recovering. And you'll feel so good. Because everything that has been troubling you will have been removed, and you will be well on the way back to health. Now, there's one very important thing that you must know, and that we must know. And that is, if you have any mental reservations, any hidden fears that you haven't talked to us about, that you haven't told us about, I'd want you to tell them to me now. Because we want to know anything that might be on your mind, anything in the way of a mental reservation about the operation. Because if you have any thoughts that you think we ought to know about, I want you to talk to me about them right now. And this is when you get find out whether the patient has the will to die or anything like that, and when you remove the will to die, because here is the state in which you can remove the will to die so easily. And you know that if you discover the will to die and you find that you cannot remove it, you postpone the operation, because you know what trouble those patients can cause for you if you don't remove it. Now, you're all through talking to her now, and she's told you that there's nothing on her mind, that she just knows she's going to get well in a hurry and everything else. So then you would say to her, now, then you remember what I've told you, that in the morning when I see you in the operating room, and I tell you to close your eyes, you go into the same wonderful state of relaxation, and you'll feel so good. Now, when I have you open your eyes, notice how good you feel, and you'll get a wonderful night's rest tonight. Now, open your eyes. How do you feel?
Fine.
I'll bet you get the best night's rest tonight you ever had in the past 5 or 10 years.
I thought the class would benefit from that, so...
Yeah.
I was being orthopedist, but many men have that type of problem.
Yeah.
You aren't orthopedist, so I said you covered for everybody.
All right. Here, my wife has a note here. How to give suggestions for bursitis and injections in the knee. Well, the way I would do it is just as I've got to have some patient. Anybody have bursitis? Come on up. Would you mind? All right, now, first thing, you do have bursitis, and where is the...
It was here.
It was there. It's pretty well gone, is it?
Mm-hmm.
But you still have a little bit of the feeling there once in a while, or is it all gone?
It's pretty well gone.
All right. Well, here is the way I would give the suggestions. You know, it's an odd thing about bursitis, but while we go ahead and get rid of it for you, we can see that you have no discomfort during recovery time. And I think you'd like that, wouldn't you? Now, there's nothing that we can do with relaxation which will cure the bursitis. I think you know that. But we can give you so much relief that while we're giving you things to help you with that bursitis, you won't have any discomfort. Would you like that?
Mm-hmm.
All right, let me show you how to do it. I'm going to teach you how to relax so that you will not feel the bursitis at that tense level that most people feel bursitis at. So just take a good long deep breath and relax. Now relax completely. Now give me your hand. Now watch the hand come down. Now close your eyes. Now relax those eye muscles to the point where they just won't work. And when you're sure they won't work, test them and make sure they won't work. That's right. Now let that feeling go right down to your toes. Let it go through every muscle in your body, through every bone in your body. Every time you take a breath, relax more. Now I'm going to lift your hand and drop it, and when I do it, that relaxation is complete. That hand will just plop down, and let it plop down. That's right. That's wonderful. Now, we're going ahead, and we're going to treat that bursitis. But from this moment on, that entire shoulder area will be completely free of discomfort. You'll just have no discomfort there. You'll know that you have the bursitis, but it won't cause you an iota of discomfort. You'll be able to move your arms in any direction.